think we are there. We're at 31 participants, 9 panelists today. So with that, I think we'll go ahead and get the day started. So good morning, everybody. On behalf of the Georgia Cancer Control Consortium and the HPV Prevention and Education Work Group, I'd like to give a warm welcome to all of our participants and honored guests joining us for our annual Cervical Cancer Awareness Day for 2021. So next slide, please. So before we get into the program today, I'd like to get started with just a quick question for our audience. And so that is, have you known or do you know someone impacted by cervical cancer, whether it's a close family member, distant relative, a friend? If you can just please place your response in the window on your screen of either your smartphone or your computer once you're prompted, and we'll give a little bit of time for everyone to answer here. And if you have any issues where you can't see the prompt or the box, there should be 3 possible answers. You can just put it in the chat box. Not seeing any responses yet. Are they? Oh, there we go. We're getting some. Okay, so we have a pretty good response. So we're about 75% of the participants have responded, and 67% have had either a close loved one, someone they know, family or friend who did have or was affected by cervical cancer. And then 33%, or about a third of the participants have not. So pretty high percentage, which is what we would expect. So thank you for taking the time to answer that question. So here is our agenda for today. I'd just like to first off say thank you for taking time out of your busy schedule so we can all join together to raise awareness about an issue that's important to all of us, that's cervical cancer. So first, we'll continue with our welcome. I'll do a little bit more speaking, followed by the fellow co-chairs of the HPV work group, Dr. Darville and Adrian. Then we'll hear from our HPV champion and annual Cervical Cancer Awareness Day sponsor from the Georgia House of Representatives, Ms. Terry Anulewicz. From there, we'll move on to honoring our HPV champions from both the community and clinical practices that have exemplified a commitment to promoting HPV awareness and vaccination. From there, it'll be a privilege to hear from the person who conceptualized and implemented Cervical Cancer Awareness Day at the Capitol in Georgia, Ms. Triana Arnold-James. And then we'll conclude with a call to action and have an opportunity to connect to the HPV work group for anyone who's interested at that time. Next slide. So my name is Brian Boyce, and I'm one of the co-chairs of the HPV work group along with Dr. Gabrielle Darville and Adrian Fawcetta King. I'm a little bit out of my element. I'm actually a head and neck cancer surgeon at Emory University, and I treat throat cancers that are caused by the HPV virus. This is the same virus that causes most cervical cancers. And through treating these patients and seeing everything that they've been through with their treatments and what they have to go through afterwards, I became very passionate about doing anything and everything that I could do to try and get these cancers gone for good. And so that's how I came to become co-chair and join the HPV work group through sharing these similar goals with the members. So as we saw through the previous question, many of us have been affected either directly or indirectly by the burden of cervical cancer in Georgia. According to the most recent data from the American Cancer Society, cervical cancer is most frequently diagnosed in women in the prime of their lives between the ages of 35 and 44. They endure extremely difficult treatments that take a big toll on their lives of their family, and in society in general, from the lost time and productivity from women diagnosed with this disease. For the women that are fortunate enough to survive their battle with cervical cancer, the scars and side effects from the treatments permanently change the way that they live and interact in the world. Despite the amazing advances in treatment, the sad truth is that the majority of these cancers are completely preventable. Through adequate access to healthcare for regular screening and by vaccination against the HPV virus as recommended by the CDC, most cervical cancers can be completely eliminated. That is why we are gathered here today, to both celebrate our victories and continue the push forward in eliminating cervical cancer. Due to the COVID-19 restrictions in place at the Capitol and out of respect for the health and safety of our participants, this is the first time that this event is being held virtually instead of our traditional in-person event on the grounds of the Capitol. This event began 7 years ago through the efforts and passion of one of our speakers today, Ms. Triana Arnold-James, and through a program she established, the Susan Jolley Awareness Foundation, the Susan Jolley Awareness Program. She was and continues to be the heart and soul of Cervical Cancer Awareness Day, and her inspiration propels us forward today. 4 years ago, the Georgia Cancer Control Consortium, or the GC3, the HPV work group teamed up with Ms. Arnold-James and the Susan Jolley Awareness Program to form the event as it exists today. Since this is the first event that is being held virtually for the annual Cervical Cancer Awareness Day, we ask that you please be patient and bear with us if there are any technical issues. As a reminder, this event is being recorded and will be uploaded to the internet on the HPV Cancer-Free Georgia website. I would now like to introduce my colleagues and co-chairs who I've learned so much about treating this disease and ways to interact and engage the community from the HPV work group, Dr. Gabrielle Darville and also Adrienne Facetta-Kim.
Thank you, and I'm happy to be here. My name is Dr. Darville, and I'm a professor at Mercer University in the Department of Public Health. 2020 was a very difficult year that brought among many challenges to the way our work group functions and normally engages the community in our HPV education and awareness efforts. Despite those unprecedented challenges, our group continued to be productive and fulfill our mission to educate and promote awareness about the burden of HPV diseases throughout Georgia. In particular, in 2020, we've accomplished a complete overhaul of the structure and organization of the work group that has enabled our members to work more efficiently and create HPV educational content for the community. We've also created a standard operating procedure and guidelines for membership to ensure active participation and a method for transitioning to leadership roles. These procedures and guidelines have been adopted as a model for other work groups within the Georgia Cancer Control Consortium. We've also obtained funding from outside sources to promote the mission of the work group, develop and maintain an online educational website and social media presence for HPV Cancer-Free Georgia. We've increased our online presence and have reached nearly 32,000 Georgians in the last year through our posts. We have nearly 150 regular followers of the HPV Cancer-Free Georgia Facebook page and almost 140 on Instagram, which is largely a younger population. We also have about 30 members of the LinkedIn group devoted to this group, and some of these are not current work group members. We've also increased our membership by 30% and created community virtual outreach events and webinars that have engaged community members.
Hi, everybody. Thank you, Dr. Darville. My name is Adrienne Facetta-King, and I'm a Public Health Program Associate, which is basically a fancy name for a research coordinator at the Emory University Rollins School of Public Health. I work primarily with Dr. Robert Bednarczyk, who is an integral member of the work group here and on this call as well, on HPV vaccination promotion and understanding hesitancy for vaccination. We've done a lot of work for HPV and also expanded out. We appreciate the Georgia Department of Public Health support and guidance, leading the development of the work group, and we thank the active members and partnering agencies, some of who are represented here, for their tireless contributions and efforts to helping us achieve so much in 2020, and the goals outlined in the 5-year Georgia Cancer Plan. We hope that you, our partner, and our partners join us in this new endeavor, and that you, the legislators, join us as HPV champions as we look forward excitedly to what we collectively can accomplish for the state of Georgia in 2021.
Great, thanks, Dr. Darville and Adrienne. It's really truly an honor to work with you, and I've really learned so much. Next, it's really my pleasure to introduce Congresswoman Terry Anulewicz as our next speaker. She was born in New Orleans, but has called Georgia her home since 1994. She graduated from Agnes Scott College in Decatur, Georgia, and has been involved in community and civic service for decades, including serving as a member of the Smyrna City Council and as Mayor Pro Tem of Smyrna. She currently is a member of the Georgia House of Representatives, where she has been representing the people of District 42 since 2017. Ms. Anulewicz has been an advocate for cervical cancer awareness for many years. This year, she has already addressed the House legislature regarding the importance of cervical cancer awareness and addressing the unmet needs of Georgia citizens to help reduce the burden of this disease. She also sponsored a resolution this year in the Georgia legislature to recognize today as Cervical Cancer Awareness Day for 2021. So without further delay, it is really my honor and pleasure to present Ms. Terry Anulewicz.
Thank you so much, Brian. I really appreciate this. And I'm very glad to be back here with you today. This is my fourth time being a part of Cervical Cancer Awareness Day in Georgia. And it's different this year. Everything is different this year, but I'm so glad that we are able to be together and to celebrate all of our champions here in Georgia. You know, we know that almost 500 people in Georgia are diagnosed with cervical cancer every year. We know that the mortality rate is incredibly high. You know, we lose 123 Georgians every single year. That's cervical cancer. There are also, you know, when you're talking about HPV and this miracle vaccine, you know, we have a vaccine that prevents cancer. It's not just cervical cancer, but it's throat cancers, it's oral cancers, it's many different kinds of cancers that we need to spread the word about this vaccine. I have two teenagers. Actually, I have a teen and a tween. I have a 16-year-old son and an almost 13-year-old daughter. They have both been vaccinated with the HPV vaccine. I think it's an incredibly important thing that we make sure that parents and caregivers and medical providers know how important this vaccine is, because my kids are actually in the minority. Only 1 in 4 Georgia kids have received this vaccine. So I really think it's so important to use my platform in the Georgia General Assembly to make sure people know about, you know, again, how miraculous this vaccine is, how absolutely safe it is. I think that's a very important thing. We hear a lot about vaccines today, but we know we need to talk about how safe and effective this vaccine is, and also how available it is, because as you're hearing, we have champions all over the state of Georgia who are working to raise awareness and to make sure that people have access and they know that they have access to this vaccine. So I am again so thankful to be here today. It is an honor to have, you know, to be able to sponsor this resolution. One of the things I always try to do also is make sure that I bring in my colleagues from across the state who have champions who are recognized in each year's resolution, so they can also sign as well and be part of formally recognizing all of the work that everyone here is doing. I also want to recognize a couple of colleagues who I know are here as the attendees right now. Representative Shay Roberts from Atlanta is here today. I believe Representative Katie Dempsey is here today. She's actually Chairwoman Katie Dempsey. And I want to again thank you all for being here. Thank you so much.
Great, thank you so much for that, Congresswoman Anulewicz. You hit on so many different things there. I wish we could talk about them all, but you know, it's so important just to call it kind of what it is. I mean, this vaccine is really basically a miracle. I mean, there's not many things that you could take that can just prevent cancer from even happening, and that's what this vaccine is. And it's great to hear that, you know, you are doing what you preach as well too, and that your kids are vaccinated. And I know as soon as my kids are old enough, we'll be vaccinating them as well too. But thank you again for all that you've done. So we'll go ahead and move into our next question. And if you listened closely to Representative Anulewicz, then you might have kind of gotten a hint at the answer. But the question is, how many different types of cancers can be prevented by the HPV vaccine? So just like last time, please respond when the box prompts you on your smartphone or computer. Give a little bit of time for people to put in their answers. I think we're still getting some responses in. So. just want to also say while we're waiting, just thank you, Representative Roberts and Representative Dempsey for joining us today too. This is really special. I know it's a little different format than what we have traditionally done, but we really appreciate you being present. Okay, so y'all are good. We got the results back. So the options were 1, nobody went for 1. 2, we had a few people go for 2 different cancers. Most people said 6, which is the correct answer, and then a few people said 10, which you never know. Maybe in the future more will be linked to HPV. But as it stands right now, HPV vaccination will prevent 6 different types of cancers. So you eliminate basically 95% of these cancers when you vaccinate for human papillomavirus. So the most common one is throat cancer, or cancer of the tonsils or the back of the tongue. Cervical cancer is the next most common one. And then it also prevents the majority of anal, vulvar, vaginal, and penile cancers as well. So good job, everybody. Y'all have read up on your HPV info. So at this point, I'd like to hand it off to Jana to begin the presentations for the HPV Champions.
Okay. Hello, everyone. Thank you, Dr. Boyce. Thank you all again for joining us today. I love seeing everybody come together for such a good and important cause. My name is Jana Mastro-Giovanni. I work with an organization called Cancer Pathways. We provide cancer education and support, and we were actually a recipient of the HPV Champion Award last year. So I'm very excited and honored to be able to present this award to our 2021 HPV Champions. As you can see on the slide, these are our 5 recipients of this award, and I believe most of them are on the call. I know that not everyone could make it, but we did want to acknowledge everyone today. So first, we're going to start with Dr. Josephine Lopez. She is with Athens Kids Specialist. She was nominated for having the most improved HPV vaccination rate, with 73% of eligible patients receiving their initial dose and 63% receiving their second dose. And I forgot to mention these first 3 nominations. The first are clinic providers, and they were recommended to us by the Georgia Department of Health immunization section. So this is the first one. We don't have Dr. Lopez with us today, but we wanted to recognize them and for all of their hard work. So next up, we have Dr. Monisha Segal with Creek View Pediatrics. They were nominated because they have 90% of eligible patients are covered by the HPV vaccination at their clinic. And I'm going to repeat that again because that's an amazing statistic. 90% of their patients are covered by the HPV vaccine. So that is very impressive. I do not believe they're on the call either today, but again, definitely wanted to recognize them and say congratulations. Third is White's Pediatrics in Dalton. We do have a Miss Amber Tack with us today. She's going to share a little bit more. They were nominated because they have improved their HPV vaccination rates from 2019 by 10% or more. So I am actually going to turn it over to Miss Amber and let her share just a little bit more about their clinic and their efforts.
Hi, thank you, Jana. We are super excited to have been nominated and receiving this award. This is something that our office has been super passionate about for several years. I went ahead and looked at our numbers, and 2 years ago, we only had 70% for the first dose and then 60% for the second dose. And then January of this year, we were up to 88% for the first dose and 81% for the second dose. And I've noticed in the chat people talking about vaccine hesitancy, and that's something that we've really addressed as we promoted this vaccine for our patients, and just encouraging parents to seek out credible sources of information, because there's so much out there, so much misinformation out there and scary stuff. It looks scary, it looks real, and we just try to encourage them that it's not real, that this really protects against cancer, and that's just amazing that we have a vaccine to protect against cancer. So we're super excited to win this award. We are a level 3 patient-centered medical home. We have been for several years. I believe we were, if not the first, one of the first in the state of Georgia. So that was super exciting for us. And we do educate our clinical staff so that everyone knows. Any nurse that walks into the room is well educated on the importance of HPV vaccination for cervical cancer and throat and neck cancers. So that's all I've got.
That's wonderful, Amber. Thank you so much for joining us, and thank you guys for all your hard work.
Thank you.
Okay, we're gonna keep on. The next 2 organizations that we're gonna recognize are in our community and being recognized for their efforts in educating the public about the importance of the HPV vaccine and the impact that they have made in the public. First, we are going to start with Dr. Crystal Toombs at Brenau University. Brenau University is located in Gainesville, Georgia, and has been collaborating with Northside Hospital for more than 2 years to educate their students about cancers related to HPV. Dr. Crystal Toombs, who is the Assistant Vice President for Student Services, started the conversation, and it became a student-led initiative. And after their first HPV event in the winter of 2018, more than 50% of the students who attended that event went to get their HPV vaccination. And so now it has been a yearly event for the university. So I'm happy to introduce Dr. Toombs and let her share a little bit more about their successes.
Hello, everyone. Thank you so much for giving us this opportunity. Let me give you a little bit of background about Brenau. The university was founded in 1878 as a Georgia Baptist female seminary, and it has expanded over the years to have graduate and doctoral degree programs and a numerous of online options. We've also expanded our health and science department, which is called the Ivester College of Health and Science, and it has grown tremendously. We are no longer a women's college strictly, but we have continued to keep traditions of our women's college annually. Over the past few years, we have partnered not only with our student organization, our commuter council here on the campus, but also with Ms. Tran Nguyen, who is the community health advocate of Northside Hospital and the Hall County Health Department, to bring HPV awareness not only to our students, but also to our community. I just wanted to note that I met Tran at a foster parent event, and she was championing all sorts of just health awareness. And she called me and said, hey, let's do some things regarding HPV. And it just exploded within the institution. So I really wanted to just highlight that, because sometimes we think that we have to wait for a certain situation or a certain atmosphere or location, but HPV awareness can be championed wherever we are. We also partner with the health department to actually they come to our campus to vaccinate students. So annually, we set up times with the health department, District 3, and we provide times and the health department for our students to get vaccinated. So that's one of the ways that we were able to increase our vaccinations, because we made it more available for our students. We actually have had, in the past, we continue our annual event, which is a HPV awareness event. And in the past, we have had speakers like Miss Lisa Decker, who is a registered nurse at the Northside Oncology Center, and Cindy White, who is actually a nurse practitioner within the reproductive surgery department. And we have had participants, up to 60 participants within our programs. One thing that has guided or strengthened our participation as well is that we reach out to our faculty members and ask them to sweeten the pot, as it were, regarding our event, so that they would give their students extra points if they took selfies, if they took a picture of themselves at the event. So we were able to raise our participation and awareness in that way as well. COVID has definitely changed some of our plans for this year. So we have found ways to continue teaching and continue the awareness. This year's event, which will happen on February 11th, will be virtual. And so we will have our speaker, Dr. Erin King Mullins, and she's from the Georgia Colon and Rectal Surgical Associates, and she will be our speaker for this year. So Dr. King Mullins, she will speak about HPV warning signs, prevention, and what to do if you believe you have HPV. We also set up a Q&A for her to help bring knowledge and awareness so that people can live a healthy life and prepare for a healthy future. Because the one thing that we are so proud about regarding the HPV vaccine is that it can have you prepare for a healthy future. And all of our events highlight that. We will also be able to continue to show the videos of HPV providers, and we will continue to actually give out gifts and do our raffles as we have in the past. Because we received a mini grant this year from the Indiana Immunization Coalition and the Indiana State Department of Health to provide gift cards and prizes. And the beauty about those things this year, because we aren't meeting personally, we're able to give them Visa cards to help with transportation. So if the community joins and they are wanting to go and get the vaccine, we are giving them transportation cards to actually Uber to the health department if they are not on campus. So we are trying to make this as accessible as possible. We at the university feel that it is important to continue to make vaccines affordable, to continue the talks about prevention, and to make the community aware of every opportunity they have to get vaccinated to live healthy lifestyles. On behalf of Brenau, the board of directors, our president, Dr. Ann Sclater, and the Brenau family, we would like to thank Georgia HPV's work group for championing the HPV awareness and continuing the message of prevention. We will not rest until HPV cancer-free is not only in Georgia, but nationwide and worldwide. Thank you so much for this opportunity, and thank you so much for this award.
Okay, thank you so much, Dr. Toombs. Really enjoyed hearing a little bit more about your work. We definitely enjoy hearing the updates in our HPV work group meetings. Sounds like you guys have a lot of strategies and incentives to share and advocate for the importance in getting people vaccinated. So thank you again and congratulations. Okay, so next up, last but not least, we're excited to recognize the Northwest Georgia Regional Cancer Coalition. The Northwest Georgia Regional Cancer Coalition focuses on improving the understanding of the importance of the HPV vaccination for adolescents through numerous events throughout the year. Namely, Ms. Allison Agnew has led mother-daughter dinners in recent years, which encourage open communication and discussion within families of middle school girls about the HPV vaccine and its role in preventing HPV-related cancer. The coalition also works to expand on their efforts and includes focuses on all adolescents to improve uptake and acceptance of the vaccine and to promote clear and effective communication with their healthcare providers in the communities that they serve. So I would like to introduce, we have Ms. Allison Agnew and Ms. Erin Hernandez to accept this award today.
Thank you. Well, we are very excited and honored to be a recipient of the HPV Championship Award. And we are especially excited to share it with this distinction with all the other organizations that are reflected here today. I want to take a moment to thank the legislators that are here. Representative Dempsey and Anulowitz, we really thank you for the work that you do at the state level to ensure that we're able to continue this good work. Without your support, it would not be possible for organizations like all of us to be able to do this good work. I am Erin Hernandez, President and CEO of the Northwest Georgia Regional Cancer Coalition, and this is Allison Agnew. She is our President Cervical Cancer Program here, and it is a direct result of her efforts that we received this award today. Her hard work and just dedication to those that she serves across our region is just phenomenal, and we are really proud that she's a part of our team. I want to take just a couple of minutes to tell you a little bit more about our organization and the work that we do to combat cervical cancer and HPV in our region. The Northwest Georgia Regional Cancer Coalition is a collaboration of 15 counties in Northwest Georgia. Our mission is to develop programs of excellence in cancer-related education, communications, prevention, early detection and screening, treatment, and research across this region. We are actually a part of a larger network of the Regional Cancer Coalitions of Georgia. We work collaboratively across the state to reduce the burden of cancer for all Georgians. We work in several areas. You can go ahead and change that slide. Thanks. We work in areas of advocacy, prevention, education, screening, advocacy and research, and survivorship. And just to share a little bit of work of what we do here in Northwest Georgia, around awareness and education, Allison hosts mother-daughter dinners to educate parents and teens about the benefits of the vaccine. She does a movie screening at the schools with Some in Love, and then she pulls in a panel of healthcare workers to discuss this with teens. We do insurance navigation for the HPV vaccine. A lot of people don't understand exactly what their insurance coverage may pay for, and find places where if they're not able to access that vaccine, we know where they can go. We do a lot with provider education and resources, making sure that the healthcare professionals across our region know what tools are available to them, what scripting opportunities might be out there for them to discuss this with parents. We also do a good bit of community awareness through campaigns on social media and throughout the region to make sure that people know that HPV can be prevented, as well as cervical cancers and many other HPV-related cancers. In the area of screening and vaccination, we have a fairly large cervical cancer screening program here. We provide low and no cost screenings for women ages 21 to 65 who are either underinsured or uninsured through different screening events and relationships with our regional providers. We also provide HPV vaccination vouchers or scholarships. We partner with local partners, regional providers, to provide vaccination for those who are uninsured or underinsured. And then, of course, the vaccination navigation, we connect Georgians with health departments and other providers in the region to make sure they get the care that they need. And then lastly, we do collaborate across the state. Again, like I mentioned, the regional cancer coalitions, as well as healthcare providers, hospitals, different community organizations, to make sure that we are bringing all the best of state resources and best practices to the rural areas of our state. We are part of the Georgia Cancer Control Consortium, HPV work group, as well as the Georgia Cancer Control Consortium at large. And of course, we take our marching orders from the Georgia State Cancer Plan and everything that we do. If you have any questions or would like more information about these programs or how you can implement some of these types of programs in your area, you can reach out to either Allison or I. Our information's here. You can also visit us at any of the social media listed there or find us on the web. Thanks so much. And I think the next slide actually has just some different images of, you can see at the top, there's one of our mother-daughter dinners. We do Halloween cards and Valentine's for students to let them know about the dangers of HPV and how to prevent HPV. And they actually have a QR code. They can go to our web and find out more information, our website and find out more information. Down below, you can see another picture of one of the the dinners that we've hosted. And then we're just rolling out this month this snapshot card, and it talks about the different types of vaccines, which one is appropriate for students based on what age they are, and then they can actually punch it across the bottom to keep up with where they are, because that's one of the barriers that we find is people don't know if they received the vaccine. They don't remember if they've had 1 or 2 shots, if they need another one, when they had it and where. So we are providing these cards across the region to make sure that people can keep up that a little bit better and reduce that barrier. Thanks so much again for the award, and it was great to hear from all the other organizations today.
Great. Wow, that was just amazing to hear so much of what's going on, just to try and get us over the edge here with HPV vaccination and just getting rid of all these HPV associated cancers and diseases. It's blown away by everything that I heard. So congratulations to all of the HPV champions. Like Dr. Toom said, prevention is the best way to treat this. If we can get rid of these diseases before they can ever get a foothold, then that's the best way. While many of the champions have been dedicated, as we've heard, to HPV vaccination and awareness over several years, the fact that you were able to accomplish so much in a year as challenging as 2020 is truly remarkable, and just a testament to how hard that you work. And this hearing some of those novel ideas as well too, giving cards to bring people to the vaccine, and incorporating faculty members to give incentives to students to get there, the way that the clinic from top down at White's Pediatrics, just to promote the vaccination has been great. And then everything that Allison and Aaron have done over 15 counties is just incredible. So thanks and congratulations again. So our next speaker needs no introduction. It's Miss Triana Arnold-James. As I mentioned earlier, she is the creator and force behind the very original Cervical Cancer Awareness Day in Georgia 7 years ago. She continues to tirelessly advocate for cervical cancer awareness through community education and improved access to healthcare for Georgians. She has done this both locally, nationally, and on the international stage as a global humanitarian delegate. Before our next speaker begins, we do have a quick video that was sent in for her that I would like to share, and then Miss Arnold-James will speak. And we might have to restart the video. I don't hear the audio.
Hey, I'm Mayor Derek Norton here in the city of Smyrna, and I wanted to take a minute to join you and recognize the efforts and tireless activism of one of my great friends, Triana Arnold-James, regarding cervical cancer. And this month, coming up on January 21st, we have a proclamation from the city of Smyrna recognizing Triana for all of her efforts preventing cervical cancer. It's a Cervical Cancer Awareness Month. She had a friend, Susan Jolley, who passed away of cervical cancer and has been a huge advocate ever since. And I wanted to just take a minute, thank her for her efforts, and read to you the proclamation that we're going to be doing on January 21st. A proclamation by the mayor of the city of Smyrna, Cervical Cancer Awareness Month, January 2021. Whereas in honor of Cervical Cancer Awareness Month, the Susan Jolley Awareness Program brings awareness to the impact and prevention of cervical cancer and the activism of Triana Arnold-James. And whereas cervical cancer strikes nearly 13,000 American women each year, and whereas cervical cancer most often affects women in the prime of life, and whereas regular cervical cancer screening tests are effective in detecting the disease early when it can be effectively treated, and whereas cervical cancer vaccines are available that, together with screening tests, provide a formidable and effective means of preventing this disease. And whereas increasing awareness among patients and health care providers alike regarding the best use of these prevention tools is a key component in safeguarding women's health. Now, therefore, I, Derek Norton, Mayor of the City of Smyrna, do hereby proclaim January as Cervical Health Awareness Month and encourage all citizens to recognize that cervical cancer is preventable and to encourage and support the women in our lives in taking charge of their health and availing themselves of the tests and vaccines that have proven so effective in preventing cervical cancer. This is going to be a great thing for our citizens. Thank you again, Triana Arnold-James, for raising awareness of this critical issue, and I wish you all the best. Thanks for all you do.
Great, thanks for that video, and so now I'd like to introduce Miss Triana Arnold-James.
Hello, good morning. I guess the host has to take my video. Okay, I'll ask to start your video. Okay, I'm still getting used to this Zoom and being at home. But good morning to each and every one of you. And I want to say congratulations to all the HPV champions. Yes, I started this 7 years ago when, as you see, one of my best friends, Susan, had passed away. And if I won't go through the whole story again like I do every year, but if you all want to know more about it, you can go to our Facebook page, the Susan Jolley Awareness Program, and also look at the video on YouTube, which is the Susie Q story. The Susie Q, and that's one of the nicknames that I used to call her, Susie Q. But I wanted to share with you all a little bit different this year. You know, during that time, the difference between Susan and I was the fact that I was a veteran and that, you know, I had healthcare. And she did, and the Affordable Care Act was in its first or second stages of getting to the people. And so, you know, she was not able to get proper care and even early diagnosis because of this terrible disease. And she did what most Georgians do, go to the emergency room. The emergency room became my primary care, became her primary care doctor. And that was so unfortunate because there's so much information out there. And when I learned, really dived into the Susan Jolley Awareness Program, it touched my heart because, you know, even with my OBGYN, they said that no woman should be dying because of cervical cancer and that it can be prevented. And so, you know, the more and more I got into the education piece about it, I learned that HPV was one of the ways. And I admit I was one of those parents that fully didn't understand, you know, the HPV vaccine. But the more and more I got into it and the more and more I learned about it, I knew that it was comfortable for my daughters to receive the vaccine, which I have 4 girls. I have 8 boys. Between my husband and I, we raised 8 boys as well. So that's 12 kids between the 2 of us. And our 4 girls have received the HPV vaccine, in which, you know, then I later found out that boys can get it too. And so I reach out to each one of you all. Let me backtrack a little bit. I also want to acknowledge Terry Anulowitz. Thank you so much for picking up the baton so that we could continue to do this with our Georgia legislators and continue to advocate on a policy level. I also want to thank Stacey Evans, representative now on House District 57 now. When we started, she was my representative and really just helped me to dive into it and advocate on a state level for this. And then I later on branched out into national level and international level because I believe that no woman should be dying because of this disease. But on a larger scale, I believe that the one component that's missing and why there's a hesitance in getting the vaccine is because of education. And one of the things that I did in 2020, even under this pandemic, was go into more about educating everyone especially low-income communities and Black and Brown communities, about why this HPV vaccine is really, really important, and getting pap smears and abstinence as well. And just educating young people that you can get the HPV vaccine and that it's okay. And so I just really appreciate the Cancer Consortium for partnering for the last 4 years. I look forward to what we could do in 2021, 2022, because I know 2021 is going to be also a trying year for us because of this pandemic. And so what we could do is, because we can't meet face to face, is to continue to put out our in our network the information, the education about HPV and the prevention of cervical cancer. And the more and more we talk about it, and the more and more we do, the more and more lives that we can save. And I appreciate Mayor Norton of the city of Smyrna. I'm from Smyrna. Terry knows how that feels to be from a wonderful city in the state of Georgia. And also I've been working with the mayors of different other counties to get the proclamation done. And we'll do that throughout the year and continue to our message on educating people about HPV and the prevention impact of cervical cancer. And I also started working with small businesses, educating their employees that may, the parents that may have younger girls and boys, and going about with different small businesses, especially to educate them about low income and Black and Brown communities. And I believe with this track, we're able to get more information out there when we're educating the community. We're working with small businesses. We're working with medical professionals to keep this information out there. And I think that the component of education, if we do more and more educating about this disease, that it will be better if we take on that helmet of educating people, that it would be one of the ways that we can prevent this terrible, awful disease. And just a little bit about me, Susan and my OBGYN and the Lord up above saved my life. Because there are things when she was going through things, I was going through things myself, and different symptoms of that could have turned in to cervical cancer because I had precancerous cells. And but like I said, the difference between her and I is the fact that I'm a veteran of the United States Army. And I was able to go to the VA in order for me to get the tests, the treatment, and everything else that I had to endure during that time. Even though I believe that God didn't make mistakes, I do still believe that she could have gotten an early diagnosis and proper medical care had Georgia expanded Medicaid. But that's a whole nother story. But I'm so excited that we are still doing this, even though we're in this pandemic, and we're able to do this Zoom and really get the word out there and keep sharing, keep educating to the champions. Once again, thank you all so much for everything that you do. Feel free to reach out to me anytime. I work throughout the year. I have made it my life work, not only to educate people about HPV and cervical cancer prevention and the impact of it, but also just to make sure that we are saving lives. And everything that you do, you are saving lives. And I really appreciate that. Thank you, Jana and Amber and Terry and Brian. Thank you so much for that wonderful introduction. And also, let's continue to be champions, not only during the month of January, but all year long. I think that's all I have. And I really appreciate each and every one of you all. And I look forward to working with you throughout the year and 2022.
Great. Thank you so much, Triana. That is, an inspirational story and heartbreaking in so many ways too. It's something that we see way too often, which is people who do not have access to appropriate medical care and seeking care again and again through the emergency room, and it's just not adequate, and people slipping through the cracks. And so thank you for sharing that story. Thank you for everything that you've done. Thank you for just your tireless efforts, your spirit, your enthusiasm, compassion that you have are an example for all of us. And then thank you for your service to the nation as well, for being a veteran. So so now we're moving on to the end of our program today. And while we should certainly celebrate the progress that we have made in eliminating cervical cancer from Georgia, we also must acknowledge that we cannot rest and the work is not done yet. Just like Triana said, education is going to be the cornerstone of everything that we do. There are still women in Georgia who do not have access to adequate health care for cervical cancer screening. So we can't vaccinate everyone, but we can catch these precancerous lesions before they become cancerous through appropriate screening. And 1 in 5 women are not getting the appropriate screening that they need. There's still the challenge of ensuring that children in Georgia get the appropriate recommendation for the HPV vaccine, and that does include boys and girls. The most common HPV associated cancer is actually throat cancer, and that is most common in men, with cervical cancer being close second, and obviously in women. So on the screen now is the infographic that Congresswoman Anulewicz shared with the Georgia legislature during her presentation. And I just want to focus your attention on the right-hand side of the slide. And this is where, if you want to know how to help, this is how you can do it. So support programs like the ones that our champions were recognized today that provide cervical cancer screening and HPV vaccination. Support organizations providing public education about HPV cancers and the HPV vaccine, like the Susan Jolley Awareness Program, the HPV Prevention and Work Group, the Northwest Georgia Regional Cancer Coalition. Any way you can support these organizations is going to help eliminate HPV-associated diseases in Georgia. Then advocate for health coverage for Georgians for HPV vaccinations that are based on CDC recommendations. So currently, Georgians who are covered by Medicaid are not, men up to age 26 are eligible, and the CDC recommends that they get the HPV vaccine, but Medicaid in Georgia does not cover that vaccine at that in that age group, 18 to 26 for men. They do for women, but not for men. So that's something that we can change, something concrete that can make headway in fighting this this disease. And then another way is that we can advocate for pharmacists to be able to provide HPV vaccinations without a physician's prescription. So like Dr. Toombs was doing at Brenau, we need to make this vaccine available and remove any barriers that are out there that make it more difficult for Georgians and patients to get this vaccine. So Georgia is a little bit behind. Most states allow pharmacists to provide HPV vaccinations without a physician's prescription. So that's a way that we can move forward. So this is where we need your help, and to accomplish these big things, it takes people like you all coming together and committing to promote these goals. So with that in mind, our last question, if you can advance the slide, is are you willing to tell your friends about the importance of HPV vaccination to prevent HPV-related cancers like cervical cancer, throat cancer, anogenital cancer? Give a few minutes for everybody to respond. Got 32 people in, everybody's saying yes so far, which is what we want to hear. Great. Looks like we're getting some buy-in. Everybody's saying that they're going to go promote HPV awareness, HPV vaccination, which is awesome. So if you are interested in connecting with our group, or if you want to learn more about how you can help, This last slide has our contact information. If you specifically would like to become more involved with the HPV Prevention and Education Work Group, or just like to know more about it, you can contact Ama Boache. Her email is at the bottom left hand of the slide there. So I would just like to give a huge thank you to all of our participants, all of our guests, all of the awardees today for just taking the time to make this day special. I'd like to also thank the Georgia Department of Health for funding of this event, the GC3, the HPV work group and co-chairs, the Policy and Advocacy Subcommittee, especially Jan and Leanne for all their work they put into this, Triana, Representative Terry, you know, all the work that you have done too, and just making this program possible today. Couldn't do it without you all. So, so with that, you know, I hope to see you all again in the HPV work group meetings. And if not, I hope to just see you next year at least. So thank you all for attending today.